getting accurate blood test results is crucial for monitoring your health as you age. But many women over 60 unknowingly make simple mistakes that can significantly affect their test results. If you've ever wondered why your blood work sometimes shows unexpected numbers, or if your doctor has mentioned that certain results seem inconsistent with your symptoms, the answer might lie in what you did, or didn't do, in the hours and days before your test. As a practicing physician who has ordered thousands of blood tests for senior patients, I can tell you that these preparation mistakes are incredibly common, and they can lead to misdiagnosis, unnecessary worry, additional testing, or missed health issues. The good news is that all of these mistakes are easily preventable once you know what to avoid. Today, we're going to walk through the 10 most frequent errors I see senior women make before blood tests, and more importantly, how to avoid them completely. Clinical laboratory specialists and diagnostic medicine experts have identified specific patterns in how pre-test behaviors can skew results, and women over 60 face unique challenges because they're often managing multiple medications, health conditions, and lifestyle factors that can all impact blood work accuracy. Understanding these factors can make the difference between getting reliable information about your health and getting results that don't truly reflect what's happening in your body. Before we dive into these specific mistakes, it's important to understand why blood test preparation becomes even more critical as we age. Your metabolism changes, your kidney and liver function may be different than when you were younger, and you're likely taking medications that can interact with various blood markers. Additionally, hormonal changes after menopause can affect how your body processes certain substances, making proper preparation even more essential for accurate results. The first major mistake I see senior women make is not following fasting instructions properly, or worse, not understanding what fasting actually means in medical terms. When your doctor orders fasting blood work, this typically means no food or beverages except water for 8 to 12 hours before your test. However, many women think this just means avoiding big meals. So they'll have a small snack, a cup of coffee with cream, or even just a piece of fruit thinking it won't matter. Endocrinologists and laboratory medicine specialists explain that even small amounts of food can dramatically affect blood sugar, triglyceride, and insulin levels, which are critical markers for diagnosing diabetes, metabolic syndrome, and cardiovascular risk. That innocent apple you ate just to take your medications can cause your glucose levels to spike, potentially leading to a false diagnosis of prediabetes or diabetes. Similarly, cream in your coffee can elevate triglyceride levels, making your cardiovascular risk appear higher than it actually is. Here's what proper fasting means. Absolutely no calories from any source except plain water. No gum, no mints, no flavored water, no artificial sweeteners, and definitely no just a small bite of anything. If you're taking medications that require food, discuss the timing with your doctor beforehand. Often, tests can be scheduled to accommodate medication needs, or alternative preparation instructions can be provided. The second critical mistake involves medication timing, particularly with supplements and over-the-counter medications that many senior women take regularly. Biotin supplements, which are popular for hair and nail health, can interfere with multiple blood tests, including thyroid function tests, cardiac markers, and hormone levels. Laboratory specialists report that biotin can cause falsely low or high results, depending on the specific test, potentially leading to misdiagnosis of thyroid problems or missing signs of heart issues. Clinical pharmacologists who study drug interactions with laboratory tests recommend stopping biotin supplements at least 72 hours before blood work. However, many women don't realize that biotin is also found in multivitamins and hair, skin, and nail supplements under different names. Always check your supplement labels for biotin, vitamin B7, or vitamin H, and discuss with your healthcare provider when to stop these before testing. Iron supplements present another common issue. Taking iron supplements close to testing can affect not only iron studies but also liver function tests and other markers. Gastroenterologists recommend stopping iron supplements 24 to 48 hours before blood work, unless specifically instructed otherwise by your physician. This also applies to multivitamins containing iron. The third mistake involves hydration status, which becomes increasingly important as we age because our sense of thirst naturally diminishes and our kidneys become less efficient at concentrating urine. Dehydration can significantly affect blood test results by concentrating certain substances in your blood, making kidney function appear worse than it actually is, and affecting electrolyte balances. Nephrologists, kidney specialists, explain that even mild dehydration can elevate creatinine levels, making kidney function appear impaired when it's actually normal. This can lead to unnecessary worry and additional testing. On the flip side, drinking excessive amounts of water right before testing can dilute certain blood components and also skew results. The key is maintaining normal, adequate hydration in the days leading up to your test. Drink water regularly throughout the day as you normally would, and unless you're instructed to fast from fluids, which is rare, continue drinking plain water up until your test. Avoid dramatically increasing or decreasing your fluid intake just because you have blood work scheduled. The fourth significant mistake is not informing your healthcare provider about recent illness, dental work, or minor injuries. Many senior women don't think to mention that they had a cold last week, had a dental cleaning 3 days ago, or fell and bruised their arm over the weekend. However, these seemingly minor events can significantly affect blood test results. Hematologists explain that recent infections can elevate white blood cell counts and inflammatory markers like C-reactive, protein, and erythrocyte sedimentation rate, potentially masking or mimicking other conditions. Dental procedures can cause temporary elevations in certain cardiac markers and liver enzymes. Even minor trauma like a bruise can affect muscle enzymes and other blood markers. If you've had any illness, medical procedures, injuries, or even vigorous exercise in the week before your blood test, inform your healthcare provider. They may choose to proceed with testing while interpreting results in context, or they may recommend rescheduling to get more accurate baseline measurements. The fifth mistake involves exercise timing before blood tests. While regular exercise is crucial for health, intense physical activity within 24-48 hours of blood work can significantly affect multiple blood markers. Exercise physiologists and sports medicine specialists explain that vigorous exercise can elevate muscle enzymes like creatine kinase, affect liver enzymes, and temporarily change various hormonal levels. Many active senior women don't realize that their regular yoga class, swimming session, or gardening work can impact blood results, muscle damage from exercise. Even the normal, healthy kind that helps build strength releases enzymes into the bloodstream that can be mistaken for signs of heart problems or liver issues. The recommendation is to avoid intense exercise for 24-48 hours before blood work. Light, normal daily activities are fine, but skip the vigorous workout, heavy lifting, or strenuous yard work until after your test is complete. The sixth mistake that I frequently see in my practice involves alcohol consumption before blood tests. Many senior women don't realize that alcohol can remain in your system and affect blood test results for much longer than they expect. Even moderate alcohol consumption within 24-48 hours of testing can significantly impact liver function tests, triglyceride levels, and blood sugar measurements. Hepatologists, liver specialists, explain that alcohol is metabolized by the liver, and this process creates byproducts that can elevate liver enzymes like ALT and AST, making it appear as though you have liver damage or disease when your liver is actually perfectly healthy. These elevated enzymes from recent alcohol consumption have led to unnecessary anxiety, additional testing, and even specialist referrals that could have been avoided with proper preparation. Additionally, alcohol affects blood sugar regulation and can cause unpredictable swings in glucose levels that can persist for hours after consumption. For women being monitored for diabetes or prediabetes, this can result in falsely elevated or decreased blood sugar readings that don't reflect your actual metabolic health. The recommendation from clinical laboratory specialists is to avoid alcohol for at least 48-72 hours before blood work, especially if liver function tests or comprehensive metabolic panels are being drawn. This includes wine with dinner, beer, cocktails, and even medications or supplements that contain alcohol. If you're unsure about alcohol content in any products you use, ask your pharmacist or healthcare provider. The seventh significant mistake involves smoking or exposure to secondhand smoke before blood tests. Tobacco use affects numerous blood markers, and many senior women don't realize that even occasional smoking or recent exposure to secondhand smoke can skew results. Pulmonologists and cardiovascular specialists have documented that smoking affects red blood cell counts, hemoglobin levels, vitamin levels, and inflammatory markers. Nicotine and other compounds in tobacco can elevate white blood cell counts, making it appear as though you have an infection or inflammatory condition. Carbon monoxide from smoke binds to hemoglobin, affecting oxygen carrying capacity and potentially masking anemia or other blood disorders. Even electronic cigarettes and nicotine replacement products can affect certain blood test results. If you smoke, be honest with your healthcare provider about your tobacco use, including timing of your last cigarette before the test. If you don't smoke but were recently exposed to significant secondhand smoke, perhaps at a social event or in someone's home, mention this as well. Your doctor can interpret results accordingly or recommend rescheduling if necessary for accurate baseline measurements. The eighth mistake is not considering menstrual cycle timing for hormone-related blood tests. While many women over 60 are postmenopausal, some women continue to have irregular cycles into their 60s, and others may be on hormone replacement therapy that creates cyclical changes. Endocrinologists emphasize that hormone levels fluctuate significantly based on cycle timing, and testing at the wrong time can lead to misinterpretation of results. For women still having periods, certain hormone tests need to be timed to specific days of the cycle for accurate results. For example, progesterone levels should typically be checked about 7 days after ovulation, while other hormones are best measured during specific phases of the cycle. Testing at the wrong time can suggest hormone imbalances that don't actually exist, or miss real imbalances that need treatment. Even for postmenopausal women on hormone replacement therapy, the timing of medication relative to blood draws can affect results. Some hormone tests should be done at specific intervals after taking your hormone medications, while others should be done just before your next dose. Always discuss with your healthcare provider when to take your hormones relative to blood test timing. The ninth critical mistake involves not disclosing all medications and supplements you're taking, including those prescribed by different doctors, over-the-counter medications, and herbal supplements. Clinical pharmacologists who study drug laboratory interactions report that many common medications can affect blood test results in ways that patients and even some healthcare providers don't always consider. For example, aspirin and other blood thinners can affect clotting studies and platelet function tests. Certain blood pressure medications can affect kidney function markers. Antacids can interfere with mineral absorption and affect certain blood chemistry results. Even herbal supplements like St. John's wort, ginkgo biloba, and garlic supplements can interact with various blood tests. The challenge for senior women is that you may be seeing multiple specialists who prescribe different medications, and your primary care doctor ordering the blood work might not have a complete picture of everything you're taking. Before any blood test, create a complete list of all medications, supplements, vitamins, and even over-the-counter products you've taken in the past week. Include the names, dosages, and timing of when you last took each one. Don't forget to include eye drops, nasal sprays, topical creams, patches, and any other medications that might seem insignificant. Some topical medications can be absorbed systemically and affect blood results. Always bring this complete list to your appointment or provide it to your healthcare provider before testing. The 10th and final mistake is not following specific instructions for specialized tests. Different blood tests have different preparation requirements, and senior women often receive multiple types of specialized testing that each have unique preparation needs. Laboratory medicine specialists emphasize that generic preparation instructions don't apply to all tests, and following the wrong instructions can completely invalidate results. For example, lipid panels typically require 9 to 12 hours of fasting, but some advanced lipid tests require different preparation. Thyroid function tests may require stopping certain medications for specific time periods. Vitamin D testing can be affected by recent supplement use. Iron studies require stopping iron supplements, but may also require avoiding vitamin C supplements that can enhance iron absorption. Some tests require you to continue your regular medications, while others require temporary discontinuation. Some tests need to be done at specific times of day because of normal circadian rhythm variations in certain blood markers. Cortisol levels, for example, are naturally highest in the morning and decline throughout the day, so the timing of collection is crucial for accurate interpretation. Always ask specifically about preparation instructions for each test being drawn, and get these instructions in writing if possible. Don't assume that standard fasting instructions apply to all your tests. If you're having multiple tests done, ask if all tests have the same preparation requirements or if any require special handling. Here's a comprehensive checklist to ensure accurate blood test results. First, confirm all preparation instructions with your healthcare provider, including fasting requirements, medication timing, and any special instructions for specific tests. Write down these instructions and follow them exactly. Second, create a complete medication and supplement list, including everything you've taken in the past week. Include prescription medications, over-the-counter drugs, vitamins, minerals, herbal supplements, and even topical products. Note the timing of your last dose of each item. Third, inform your healthcare provider of any recent illness, medical procedures, injuries, or significant life events that might affect your results. This includes infections, dental work, injuries, surgeries, major stress, or changes in your regular routine. Fourth, maintain normal hydration and avoid alcohol for at least 48 to 72 hours before testing. Don't dramatically increase or decrease your fluid intake, but ensure you're adequately hydrated with plain water. Fifth, avoid vigorous exercise for 24 to 48 hours before testing. Light, normal daily activities are fine, but skip intensive workouts, heavy lifting, or strenuous activities until after your blood is drawn. Sixth, plan your appointment timing carefully. Schedule morning appointments when possible for fasting tests, and consider your energy levels and transportation needs. Bring a snack to eat immediately after fasting blood draws to prevent low blood sugar symptoms. Finally, don't hesitate to ask questions. If you're unsure about any preparation instruction, call your healthcare provider's office for clarification. It's better to ask twice than to have inaccurate results that could affect your healthcare decisions. Remember that accurate blood test results are essential for monitoring your health as you age. These tests help detect early signs of disease, monitor the effectiveness of treatments, and guide important healthcare decisions. Taking the time to prepare properly ensures that you and your healthcare provider have reliable information to work with. Laboratory errors due to improper preparation can lead to unnecessary anxiety, additional testing, incorrect diagnoses, or missed health issues. By following these guidelines, you're taking an active role in ensuring the best possible healthcare outcomes for yourself. Most importantly, view blood test preparation as a partnership with your healthcare team. Your doctor orders the tests to help monitor and protect your health, but the accuracy of those results depends partly on your preparation. When you follow preparation instructions carefully, you're ensuring that your healthcare team has the most reliable information possible to guide your care. If you have chronic conditions like diabetes, heart disease, or thyroid problems, accurate blood test results are even more critical because they guide medication adjustments and treatment decisions. Small preparation mistakes can lead to inappropriate medication changes or missed opportunities to optimize your treatment. Don't let embarrassment or forgetfulness prevent you from being completely honest about your preparation. If you accidentally ate something during a fasting period, had a glass of wine the night before, or forgot to stop a supplement, tell your healthcare provider. They can decide whether to proceed with testing while interpreting results in context, or whether to reschedule for more accurate results. Your health is worth the extra attention to detail that proper blood test preparation requires. These simple steps can make the difference between getting reliable health information and getting results that don't truly reflect your health status. If this medical guidance has helped you understand how to prepare properly for blood tests, please give this video a thumbs up and subscribe for more reliable health information specifically designed for women over 60. Your health monitoring is crucial, and accurate test results are the foundation of good healthcare decisions. Have you ever had surprising blood test results that might have been affected by preparation issues? What questions do you have about preparing for specific types of blood work? Share your experiences in the comments below. Your insights could help other women ensure they get the most accurate health information possible. And if you're interested in more content about navigating healthcare effectively as a senior woman, be sure to check out our video about the most important health screenings women over 60 should never skip. Knowledge is power when it comes to your health, and proper preparation ensures that knowledge is accurate and useful.